Hey guys, it's Dr. Greg with Judice Sports and Rehab. Back again this Friday to do another live video for you guys. This week we're going to be talking about wrist and hand fractures. So just to get it off the table, we do not treat the actual fracture. Obviously that would be something that you would go to the ER, get it set, possibly have surgery depending on the severity of the fracture. But I wanted to talk about what a PT can do to help you guys if you had a fracture. And how to get back to being functional. So, like I said, we don't treat the actual fracture, but what we would do is make sure that the bones and the joints around that fracture are moving like they're supposed to. Typically, your hand's going to either be in a splint or a sling or casted, and what'll happen during that time is the joints around the fracture will get very stiff. Think of any time that you would keep your bones in just one position for just a few hours, you're going to feel stiff coming out of that position. Think if you're in that same position for 6 weeks. So it's expected that those joints would be very stiff afterwards, so we have to get those joints moving. So mobilizations, possibly manipulations, lots and lots of stretching around the fracture site to not interrupt that healing process, but stretching around the fracture site to make sure that all of the other joints are moving as they should. Again, if you're braced, we need to make sure that everything around the fracture, say you broke the bone here, we would want to make sure that the bones through the wrist and through the rest of the hand are moving as they should. As we hopefully are not, but as we near the end of baseball season, let's kind of talk about some of the Cardinals players. So we've had a few fractures on the team in the last couple of years. Paul DeYoung and Yadi Molina have had hand fractures over the last couple of years. And so obviously it's kept them out of the games for multiple months. But the actual healing time for those breaks are not that long. Think of how skilled their hands have to be to play a high-level sport like that. So it's not just get everything healed. It's the building the strength, building the mobility, building that skill again, and getting back into the habit of doing those skilled activities. So there's a lot of things that we would work on, in particular weight bearing through the newly healed joint. We'd be working on skill activities. We'd be working on strengthening, gripping activities, combined motions using the shoulder and elbow and the rest of the body to get them back towards their sport-specific activities. So just wanted to give you guys some more information on the wrist and hand, and that'll wrap up this month. So this was wrist and hand month. So if you have other questions about wrist and hand, please feel free to comment below or check out our previous videos over the last month or so. We will have a new joint announced for next week, and I will see you guys next Friday. Thanks.